Welcome back. Today is a special day for a special test. Today we'll be doing the sacroiliac joint fixation test. For this test, the subject will stand with the sacroiliac joint exposed. The examiner is then going to stand behind the subject and with their thumbs over the posterior superior iliac spine. The action of this test, the examiner should note whether the posterior superior iliac spines are level. If the posterior iliac spines are not level, the sacroiliac joints are asymmetrical, indicating fixation on one side or the other. This is the SI joint fixation test. Alright, howdy there. Today we're going to be doing the Gainsland's test. For this test, the subject is going to be lying on the table with the uninvolved side hanging off the table. With the involved leg in slight hyperextension. The subject then flexes the knee of the uninvolved side toward the chest. The examiner stabilizes the subject's pelvis and further extends the subject's involved leg. A positive finding will show pain in the sacroiliac region. This may be associated with sacroiliac joints dysfunction. This is the Gainsland's test. Thank you. Alright, today we're going to be doing the slump test. And for the slump test, the patient is going to sit at the end of the table and lean forward while the examiner holds the head and chin upright. For this test, any symptomatic changes reported by the subject will be noted. The examiner is going to flex the subject's neck and assess for any changes in symptoms. If there are no changes noted, the examiner passively extends the subject's knee. Again, symptomatic changes are assessed. With no noted changes, the examiner will then passively dorsiflex the subject's ankle while the knee remains extended. The subject is then returned to the original slump position and the test is repeated for the other leg. Now, a positive finding will result in a complaint due to sciatic type pain or any reproduction of symptoms is indicative of a positive test. Thank you. This is the slump test. Alright, welcome back to a special test with Mr. Gregory and the crew. Today we're going to be doing the Valsalva maneuver. And to do this test, the subject should sit on a table. And then the examiner traditionally will stand next to the subject. The action of this test is the examiner is going to ask the subject to take a deep breath and hold while bearing down. This will be like having a bowel movement. Increased pain due to increased intrathecal pressure, which may be a secondary to space-occupying lesion, herniated disc, tumor, osteophyte, in the cervical canal is a positive finding. Pain may be localized or referred to the corresponding dermatome. Special considerations are as follows. The increased pressure may also alter venous function and cause dizziness or unconsciousness. If this happens, the examiner should be prepared to steady the subject. Thank you. That's a Valsalva maneuver.